Well, one of the highlights of coming to SAWC over the years is not only the lecture content, but it's the exposure to new technology. I mean, I've always looked forward to being able to walk on the exhibit floor and see what kind of new products are out there, and then to be really providing my own vetting process, if you will. Seeing new products, you don't necessarily just take the word for what's being presented to you on the floor, but it gives you the opportunity to start reading a little bit more, asking other colleagues their experience, and then finally taking that knowledge and begin applying it where it's warranted. So, I've learned about some really fascinating things over the years. Well, I've kind of taken a step back from my clinical practice. However, interestingly, even though we're not working in a true wound care center under the roof of one hospital, we've been using the interdisciplinary model for years. We've used hospitalists, we use interventional cardiologists and vascular surgeons, nephrologists, nurses, nurse practitioners, physical therapists. It just goes on. And so, we really try to really educate and let people in our community know that what we're working with here in terms of wound care and limb preservation, it's a community-based problem. And the only way we're going to start making real impact and positive change is by working together. We can't be functioning independently. The patients that we see are generally far too sick. There are too many comorbidities. So to try and think that somebody could manage these patients by themselves is really foolish. SAWC is a must. Anybody who really wants to learn about wounds, this is the place to really start. It's just comprehensive. There's something for everybody. There's something that is entry level in a sense, but you also have advanced modalities. The dynamic that goes on at SAWC is really, really critical too. It's that one time where you can all come together as a community and experience interactions with others. Even if it's a 5-minute conversation with somebody, you can get so much out of that you can't get from just watching a video conference or looking at an article, if you will. And I think what's happened with our own personal experience, our organization, Save a Leg, Save a Life, really, in a sense, got a push because of SAWC. I was coming back from one of the San Diego meetings years ago with my wife, Deanna, and we're on our plane, and I said, what's going to happen when all the people on this plane go back to their community? They've just spent 3 or 4 days at this great meeting, but is anything really going to change when they go home? And is there going to be pushback from others? And why aren't there people from our community on this plane either? So our whole idea was, let's start taking some of this advanced information and start spreading it out at the community level for the people that are not attending the national conferences. And so here we are, several years later, and now we're up to about 60 chapters around the country, and there's a real good chance we'll have some international chapters established before long as well. So, we owe a lot to SAWC, the experience, the people, and hopefully it's going to continue and grow stronger every year. Yes, well, these days I'm doing quite a bit of speaking, so I've kind of made a transition from clinical practice more to being an educator myself. So, it requires me to become, or to stay current with information, whether it's through writing or going out and speaking. So, part of what I do is really try and teach others what I know and take some of my clinical experience and apply that as well. I'd say probably one of the really important things that I've seen in my career, which is over 15 years now, is the level of education that students are coming out of school with in terms of wound care and the value that's placed on it. When I was a student, really, we had information, but we didn't have wound management as a specialty per se. So to see where we've come in the last 15 years, it's exciting. The students especially understand the importance of limb preservation, and I see young podiatrists coming out and understanding the role that they have with the interdisciplinary team and how their education and their experience level is really valued by the other doctors and nurses. You know, it's interesting. My first year of training was at the VA Medical Center in Philadelphia, and even though we had, you know, a clinic per se, we didn't have a dedicated wound care clinic. But that's where I got my real interest and desire to pursue wound management as a career path. And if it weren't for the fact that I had a great mentor there, Ann Sonoga, she allowed me to explore wound care, to read up on it, to attend local meetings that were held in the Philadelphia area, and allowed me to begin applying some of that knowledge. And the amazing thing was that, you know, originally going through some of the charts that we would see, there was not anything really advanced that was being used at the time. So even just being able to integrate things such as collagen or alginate, we started making progress with patients, and it was really gratifying, and I owe her so much, as well as some of the other docs who were there. There's actually been really a lot of great moments over the years, and I think the thing that I really appreciate the most has been the sense of camaraderie amongst the attendees. You know, we look forward to seeing each other every year, and I've really developed some great friendships through the years of attending the conference.